everyone. Welcome to Employer Insights, Career Paths in the Health Field. Thank you so much for joining. This event is being hosted by Devant, and my name is Sisha Maharaj. I'll be your moderator this evening. My background, I work as a senior consultant with Devant. I'm really passionate about helping to connect employers and job seekers, specifically helping to remove barriers for international students and newcomers to Canada. As part of that, really helping to build bridges and networks for you in different industries that you're interested in working. And today, before we get started, just a little bit of logistics. This is going to be recorded. We like to have this as a resource for others who are not able to make it today, but you will get a copy of the recording. This is a very special topic that we're going to be speaking about today, and it's going to be very interactive as well. So if you feel comfortable, feel free to leave your camera off. If you would like to come off camera, that's okay as well. You can ask your questions by raising your hand at the end. I will be taking live questions, but in the meantime, as we hear the conversation, feel free to put your questions in the chat, and I will go through those to go through and ask our guests some of those questions. Okay, so before we start, we've got quite a few people here today. Let's get to know each other a little bit. Please introduce yourself. Let us know, what educational institution are you joining us from? So take a moment. Hopefully that you can see the poll there. Please let us know a little bit about yourself. Also, what was the highlight of your Canadian school experience so far? We see students from Centennial College, Conestoga College, welcome. King's College, Lambton College joining us today. A few other colleges and universities as well. Wonderful. Please keep answering the chat in the polls. Wow, wonderful. Thank you so much for participating in the chat. So I'll leave that up for a little bit. Wanted to sort of let you know as well, we are hosting this on behalf of Devant, and Devant helps students and graduates get hired in Canada. Devant in French means to get ahead of, and that is our aim for you. We want to help you get ahead of the competition and in front of employers so you can build your dream Canadian career. So please feel free to check out our website at www.devant.ca for other resources as well as career development supports that you have. If you're wondering if your school is a partner, you can go to the login page and you can sign in with your school email to get free access to a number of different tools that you can leverage to help you in your job search. So I'm just going to share the results so that you can see quickly where your colleagues are from. Just a reminder for those of you who are joining us right now, please do use the chat, introduce yourself, and let us know what area or program that you're studying in at your college or your university. So without further ado, it is my absolute pleasure to introduce Ranika Singh. She's the founder and consultant of IMG Counseling. She graduated from the University of Toronto and she's over nearly 20 years of experience, both in domestic and international healthcare recruitment. She's developed her expertise over an 11-year career at an Ontario government agency, an innovative healthcare recruitment initiative designed to help local and international medicine graduates navigate their pathway to success in Canada. So we're extremely excited to have Ranika join us and share her expertise. Ranika, welcome. Thank you so much.
Thank you so much, Asisha, for inviting me today. And I'm so excited to share some of my insights and to be here with you all.
Great. So before we begin, I would like to share a little bit of a land acknowledgement. Although we are joining this webinar from across the country, I want to acknowledge the land where I am residing today for this webinar. I'm actually in the region of Durham, and we exist on the lands of the Mishi, Sagi, Anishinaabe, inhabited for thousands of years prior to European colonization. These lands are the traditional and treaty territories of the nations covered under the William Treaties, including the Mississauga of Scugog Island First Nation, Alderville First Nation, Hiawatha First Nation, Curve Lake First Nation, and the Chippewa Nations of Georgina Island, Bosole, and Rama. I honor, recognize, and respect Indigenous peoples as right holders and stewards of the lands and waters on which we have the privilege to live. In our efforts towards reconciliation, we continue to build and strengthen relationships with First Nations, as well as the large Métis communities and the growing Inuit communities here in Durham. I'm committed to learning from Indigenous values and knowledge and building opportunities for collaboration and recognizing that we are all connected here on this land. So I just also wanted to pass now the floor to Ranika. I've got a few opening questions for you. And I know our students, newcomers, and our guests will have some questions for you as well. So Ranika, maybe you could start off maybe by sharing with us and elaborating what are the types of supports and services available in your organization, International Medical Graduate Counseling? What do you offer to international medical graduates, and what do you offer to your clients?
Thank you so much for that question. So yes, I would love to share. So I help international medical graduates with their navigating their licensing requirements here in Canada. So my client group are international medical graduates who have immigrated to Canada or are Canadians who decided to study medicine abroad. And how I do help them is as early as perhaps as entering medical school abroad or even before they arrive to Canada. So I can help them with understanding the complexities of the medical licensure process in Canada because it is very complex, very timely, and at times confusing. And I help them with developing action plans, understanding the different timelines, how they can develop their portfolios over the years. And at the time that they are ready to apply for an opportunity to pursue licensure, I can help them specifically with their residency application, as well as other programs that are available to them, such as clinical fellowship. I think I saw somebody here who did mention that they're currently in clinical fellowship, so I can help with applying for pretty much any clinical role in Canada, as well as opportunities where they can be assessed based on their current skill set. So we do have practice-ready assessment programs in Canada, and these are more for international medical graduates who have had opportunity to practice independently, and that way they can be assessed on their current competencies in Canada. So as I mentioned, I offer a lot of guidance, consultation, setting realistic expectations, as well as helping with documentation, as anyone here has already been probably used to. Applying for programs and keeping up with your documents can be timely and confusing. So having those documents are evolving and always changing. So I'm helping with developing them, finalizing them, any other documentation that's needed, as well as helping them prepare for assessments. So in Canada, for a lot of these clinical programs, there are MMIs that are needed. There are ethical assessments that are required. So I help them with understanding what those competencies would be to be able to meet those expectations, and helping them prepare themselves, helping them with their communication skills and also with their presentation skills. As some of you already know, if you are thinking about or have already started applying for positions, the interview process in Canada can be really challenging and often very intimidating. So I help my clients with developing their communication skills or presentation skills, and just empowering them to be confident and just bringing them their best selves forward, because oftentimes that is what is going to make the best impressions in front of those programs, is if they are just themselves.
Mm-hmm. Wow, that's incredible. Thank you so much for sharing all the services that you offer, Ranika. I think that we're going to have a lot to talk about and learn together from your experience. I'm just curious, what helped you get into this field, and in terms of your background and your experience, you mind to share a little bit about your own sort of journey to this role and this business?
Oh, thank you. Thank you. That's a wonderful question. I don't really get asked that a lot, so I would love to think about that. So I think I've always been always interested in counseling. I've always been interested in career counseling. And when I graduated, my first position had been more of a marketing position, but helping those who were currently pursuing medical school in Canada. So I was involved with more marketing and communicating and helping those learn more about some of the courses that could help them when they're thinking about taking the MCAT for medical admissions in Canada. From there, I was able to get a position at PARA, which is the Association for Interns and Residents in Ontario. So if you become a medical resident in Ontario, you would be a part of that association. And I was involved in a program that was helping the residents with their transition into practice. So I started becoming more interested in physician recruitment, and I joined a new agency, a government agency, when it was created in 2009. I believe it was 2009. It was a while ago. I was there for about 11 years, and I worked in different programs with physician recruitment, advising, and then finally with international medical graduates. And it wasn't until I started working with international medical graduates that I really felt that I finally, I guess, found my calling. I was very passionate about this role. It was really inspiring for me to work with so many candidates who have had so much of a past and history, and had brought so much motivation, and also had so many challenges. But we're still fighting through those challenges, and continuing to pursue their true ambitions and dreams. And that really, really motivated me and inspired me, and wanted, I guess, allowed me to continue in this path even after I no longer worked at the agency. Yeah, so the last couple of years, I've just been really heavily involved with continuing to support IMGs and advocate for them. I've also been able to advocate and had been invited by the CTV News channel. I'm currently part of a committee that is bringing recommendations forward and really trying to support the integration of IMGs into Canada.
It's so needed. Thank you so much for sharing your personal journey. I find it just so inspiring to hear how individuals have landed with their current roles, but also see the connections that maybe others may not have seen yet for themselves. And I see in the chat, there's such a diverse set of individuals here. We've got a number of IMGs, we have students, we have graduates from across the country. So just to make sure we're all on the same page, if it's okay with you, can we start off by getting maybe a better understanding of like what is the process to become a doctor in Canada?
Sure, that's a wonderful question. So the process in Canada would be, and it differs from country to country, and obviously it's different for an IMG who's considering a medical licensure in Canada. I can explain that process as well. But after graduation from high school, as you're pursuing a bachelor's degree, you would apply for medical school, and there are 17 medical schools across Canada. At that point, when you are accepted into a medical school in Canada, you would be at first learning, there would be training, opportunities for collaboration, extracurricular, perhaps research as well. And the last few years are more dedicated to clinical rotation. So this is where you have the opportunity to rotate in different clinical environments and settings and learn more about different specialties. And you also get the chance to learn from preceptors and be involved in teaching hospitals and clinics, and also for yourself, figure out which specialty is that you want to pursue going further. So in your last year of medical school training, it's a 4-year program. You would then be considering different specialties, and you would need to apply to a medical residency training program afterwards. So after you complete your medical school training and you receive your license, there you are applying for a medical residency program across Canada. And the way that it works, it's more of a match system. So that would mean that you may have a couple of specialties that you are considering. Perhaps maybe you are interested in being a family doctor afterwards, or perhaps a psychiatrist. So you would apply to different programs, and hopefully with a strong application, receive multiple interviews. And at that time, you are waiting a little bit longer, maybe a month or two afterwards, until you find out which program had ranked you the highest and where you ultimately ultimately match. So it is a little bit of a guessing guessing game, a waiting period when you finally, when that's the time that you're applying to when you finally do match into that residency program. And then that residency program is the last part of your clinical training. So you would be in this program anywhere from 2 years to 5 years. As an example, family medicine in Canada is currently 2 years training program, which is less than many other countries. And then as an example, psychiatry is a 5-year residency training program. And towards the end, so you do receive a postgraduate license at this time. What this means is that you are able to make independent decisions in the clinical settings. However, you are still training, you're still supervised. Towards the end, you are studying and taking your final examination. Once you pass that final examination, you are then applying for your independent license in that province. And then you're a doctor. So at that time, you are able to start your own practice, join a practice, perhaps work at a hospital. And if you wanted to actually pursue further training, which a lot of doctors do at this point, you could pursue clinical fellowship or specialize a little bit further.
Wow. Okay. So the entire process from the beginning to the end is how long?
It could last anywhere. I mean, after starting for medical school, right? Medical school is 4 years, and then perhaps, well, depending on the specialty, if we add 4 years plus 5 years of specialty training, 9 years plus any other training, perhaps, I don't know, somewhere between 9 to 12 years, and then you are able to practice.
Okay. Okay. Thank you. And what are you seeing are some of the common misconceptions that international medical graduates might have about the process of becoming a licensed medical professional in Canada?
That's a great question. I think that probably the biggest one would be the fact that it's impossible to match. Things have really changed a lot over the last couple of years, especially with more information being accessible online. I often feel that online there could be a lot of information that is not accurate or maybe outdated as well. And it's important to know that, at least with what I've seen, I've been working in this field and closely following the IMG process for 8 years now. Things change often, and in my experience, things are actually improving. But because there is a lack of clear information, it's not centralized, and it's really nobody's fault. It's just that there's so many different parts to the process, and different provinces have different requirements. And there really aren't a lot of people who are experts in this field as well too. For those reasons, and maybe, different people's experiences and what they've gone through. I mean, to be honest, it's a very competitive process, and there are a lot of IMGs who are interested in applying per year. So I'd say that the biggest misconception would be that the fact that it's just impossible. It's impossible to practice and that it's never going to happen. But I could say, with my experiences and what I've experienced, that it definitely is possible, but there's has to be a lot of dedication, a lot of motivation, and also adaptability to the process, ability to adapt to new changes, maybe changing your portfolio, trying other pathways in the interim, and just being open to the possibilities.
Mhm. Thank you. So it is possible with the right guidance, having adaptability, and also keeping up to date with, the process. And it sounds like there's a lot of development as well. You mentioned there's interviews and the selection process, there's specific criteria in addition to sort of the academics that individuals need to be aware of. How about for those who are here who are studying life sciences but still unsure of their career options, or
Mhm.
for those who need to have a backup to a path to medicine, please share your recommendations of maybe other potential career paths that might be good alternatives to consider.
For sure. I'd say probably one that I'm very interested in and definitely would suggest is anything related to digital healthcare and technology, especially with the advancements of AI and what I've seen in different portfolios of the clients that I have been working with, and the different experiences that they've been able to obtain. I'd say that that would definitely be an interesting and a growing field. Other fields, perhaps pharmacy, especially with our aging population, nursing as well. I think that would be an amazing field as well. I have many clients who are have considered studying for registered nurse or nurse practitioner. So I can see a lot of possibilities there. Probably clinical research is another great option as well. Some of these fields that I'm speaking about, they are regulated professions. So that would mean that you would need the proper education, the training, as well as being able to fulfill the requirements, the examinations, registration. But in some of these cases, such as clinical research or perhaps personal aid, you might not necessarily need to follow all of the registration requirements. So education training would be required, but sometimes it depends on your past experiences, your connections, your network, the experiences that you've been able to build upon. So I know that, or I believe we're going to talk a little bit more about networking and how to grow your network. That's really important as well, because at the end of the day, the more confident that you are, the more better you're able to network, the more opportunities that you'll come across if you're able to have that confidence and bring it forward. And I did want to mention a quick thing about just what we were speaking about in the last question that you asked me. I did want to mention that things are really improving within the landscape for IMGs. As many of you may already know, we're in a healthcare crisis, a shortage of family doctors, especially within Ontario. So I did want to mention in my experiences what I've seen. Things have really improved over the last couple of years with more opportunities, more information, and just more organizations and people coming together to make things easier for IMGs and international healthcare professionals. So that way their process is more streamlined than it had been in the past.
That's really encouraging to hear, as well as, sharing some of those alternate career paths, which may not take as long of a process to help IMGs get in, at least into healthcare, and into the environment using some of their experiences and knowledge. I'm really happy you mentioned about networking, because I'm a huge advocate for building connections, as you know, and networking. So maybe, you could share with our audience, what advice would you give to new individuals, like new immigrants or international students, to help them network effectively within the Canadian healthcare system, or to build professional relationships in healthcare?
For sure, that's a great question. So first thing, documentation is so important. I feel that, every time that you're meeting a new, potential professional, person or individual, or an opportunity arises, you always want to have your documentation up to date. So having a good working resume or a CV is really important, because you're always going to need to refer back to it. So it's really important to understand the Canadian standards and the formatting and the systems that we're currently using, so that way you're always prepared. It's always, a great, I guess, opportunity to put yourself out there and go to different events and conferences. Even attending today's session is a great networking opportunity, because you can see others, you can introduce yourself, learn about other backgrounds. So always feel free to just be aware and open to different events that are happening, because that will just build up your confidence and give you more of that confidence that you'll need to approach different individuals and have those conversations and to be able to continue those relationships. I was just working with one of my IMG clients the other day, and they mentioned that they had attended a conference the other day, and they said that the best part of it was that they met a few new friends, and few new friends that had similar backgrounds, similar goals as well. So they said that was the best part, that they were able to build up on their network. With a lot of these regulated professions, I think it's known that there are a lot of requirements and lots of opportunity for you to meet others through study groups. So I've often heard from a lot of my clients that they were able to build up their networks or learn about new opportunities just by joining different study groups. So it's almost like you get that support for studying for particular exams, but you also are able to widen your network as well. So there's so many different ways that you can network and just kind of grow that I guess the field of the people that you have connections too. A great tool that I always have been able to use and really build on my network is LinkedIn. So, I know that we had posted this event on LinkedIn as well too. So I truly believe in the power of LinkedIn. I think it's a great tool. And the reason why is because you're able to slowly grow on your network, and it doesn't have to be too exhausting or have to, to put yourself out there too much. You can just do simple things. You can work on your profile. You can make an effort to follow different organizations or groups or individuals. You could also start liking different posts or reposting. And at times you can also create your own content. So that way you can come across as a thought leader, and you can express your opinions and be able to grow your network that way. The more you're able to put yourself out there and express your own opinions about different topics related to maybe your profession or your studies, you are catching the attention of other individuals. So you're just naturally being able to grow your network in that area.
Mhm. Ranika, that's all really useful, powerful information around networking. I'm going to ask you a follow-up question in terms of the where. So if I'm a newcomer or if I'm an international student, where would I find events to network in the healthcare field? Where are things posted? Are there conferences or places for people to volunteer? Maybe you could just give a few examples, if you don't mind, of where can they find places to network or how to meet other people in the
Of course.
field?
Yes, of course. That's a great question. So I would suggest that you can consider perhaps like welcome groups. So welcome networking groups. So there's always going to be organizations and centers that are there to support immigrants with regards to just that transition to Canada, as well as just general supports. I would say another opportunity would be just to be well aware of different employment agencies that are out there, because they'll also have access to perhaps bridging programs or events or information about sessions where applicants can meet up and be able to network with each other. Maybe also at your school as well. I think that there might be access, and Devont is doing such great work and in being able to showcase and be able to provide information about different experts that are in different industries. So I think that would be a wonderful idea. Perhaps just following different groups as well on Instagram, as I mentioned, LinkedIn is great, Facebook, just knowing who the individuals are in your field. And that could be as easy as just doing some searches over Google as well.
Okay. Thank you, Ranika. I have a question actually from Wanuka. Thank you for your question, Wanuka. She's wondering if you might be able to give her a brief idea of any health and safety management fields, or if you have any thoughts around health and safety as a career path or suggestions around that path.
Yeah, sure. So I have known a couple of my IMG clients in the past who have taken different courses with regards to this field. I believe that, they could be available at perhaps the college level. And with regards to pathways, just maybe looking up different job opportunities that are available within this pathway, and just doing, the networking that we spoke about and being able to speak or learn more about this field. It's always a good idea to be able to network with those who are already working in this field to see what their pathway had been like, where they had been able to obtain jobs and job opportunities. I possibly could have access to learning more about these types of jobs and be able to share information about how you can access this in the future. An opportunity has been given to me that I could, be able to make these connections. So if you are interested in staying connected with me, please feel free to do so. You can find me over LinkedIn and be able to connect with me at a future date.
Wonderful. That's very generous of you, Ranika. Thank you so much. So now I would be remiss not to ask you some specific tips on a residency application. So if I want to move into some specifics, we do have a number of IMGs on the call right now on this webinar. Welcome to all of you who are joining us today. So wondering if you might be able to share what are some of the key steps that IMGs should take to make their residency applications more competitive in Canada?
Thank you. That's a great question. It's probably something that I'm talking about on a daily basis. So I like to describe it as something that we can maybe visualize. So thinking about perhaps the four pillars to success, or what would be required in a competitive application. So as we know, in many of the regulated pathways, or in any pathway where there is competition, there are always going to be mandatory exams. So and the medical residency pathway, the exams and the assessments are very important. So knowing what those assessments are, I find that many IMGs are familiar with the mandatory assessments, but also there are other assessments that they're going to need to be able to take during the application process. So knowing what they are and taking the time to really study and prepare for them well, because at the end of the day, when you are going to be applying for these programs, and many of these programs do have specific criteria, and it's not just a pass on these exams, you also have to do well and have a good score as well too. So just understanding that that score can be used in the criteria for these applications going further is really important for you to understand. So that way you take the time to process and study and do everything that you can to be able to prepare yourself for that. Second would be clinical recency. So hands-on clinical experience is really important. And I'm referring to perhaps, as I mentioned, you could be applying for medical residency at different parts of your pathway. So perhaps you're still in medical school training, that would be considered really good recency. So as I mentioned, a lot of Canadians study abroad and study medicine abroad. So they have a really great opportunity of being accepted into the system in their last year of medical school training, as well as if you just graduated, as well as if you had been practicing independently, as well if you just completed your internship or some sort of mandatory rotation. So having that clinical hands-on experience is really important. And sometimes because of different circumstances or situations, there is going to be a clinical gap. So if that's the case, you definitely want to think about how can you shorten that gap, or how can you obtain some clinical experience to be able to present that in front of the application process. And then also Canadian experience. They want to be able to see and know that you have a strong understanding of the Canadian clinical environment and the healthcare system that we're currently in. So you want to be involved in different opportunities, for sure, clinical experience, where maybe perhaps working as a clinical assistant or an observer, perhaps research as well for some of the specialty positions. The more research you have, perhaps any publications or presentations you've had, can be really helpful. Also, volunteering, community work, extracurricular teaching. You really want to think about your application as not just clinical, but also a very holistic package in a whole approach to your application. So that would mean also considering your communication skills, your collaboration, how often you've worked in a team. All of these aspects will just make your application stronger. And especially if you're able to speak about it and some of that documentation that I speak about. So the last part would be, what is the quality of your application? So for anybody here who is it is an IMG and you already are a little bit familiar with the process, or anybody here who's also considering to apply for a competitive profession, the application process can be very lengthy. To give you an example, I'm just at the starting of the upcoming application period that is starting at this point and will be ending sometime in March of next year. So it's a long application period. So preparing your documents, your personal statements, your essays, getting those great letter of references are really important. So having those strong connections and that strong networking that you want to have from the beginning, so, when you first start thinking about this pathway, is really important. And then, as I mentioned, I believe the most important part of this whole process and the competitiveness of everything is your interview skills and your techniques. So being really comfortable in yourself and recognizing that it's okay to just be yourself, and developing those skill sets, which often does take time because it's not easy for anybody to develop those skill sets.
I love that, being comfortable with your own sense of self and your strengths. and putting those forward to make sure that you can really shine in that interview. Sometimes it requires a combination, right, of bringing your international experience forward as well as what you're doing here in Canada as well. So I completely agree, Ranika. I've also really enjoyed some time as well, working with a lot of students in the
Mhm.
medicine program in my previous role, and who are aspiring to get into the medical program. So, I think that advice is really important. Thank you so much for sharing that. I'm wondering if maybe if someone comes to mind, I don't know, but in some of the clients that you've worked with or the scenarios that you've worked with, are there any success stories that you'd like to share of hope, or vulnerability, adaptability that might give individuals a little bit of inspiration as they go through this process?
Yes, for sure. So I've worked with hundreds, hundreds of applicants in the past. Again, as I mentioned, at the agency that I was at before, and then working independently now. So I've come across so many stories. A few come to my mind as you're asking me this question. I've worked with applicants who have had a huge gap in clinical recency for that reason, because as I mentioned to you, it is one of those strong areas that you would require or need to have a competitive application. So they almost felt as if they were, going to give up. They didn't feel like they had any hope, or didn't feel like this would be an appropriate pathway for them. So what I recognized for some of those candidates was that they continue to be heavily involved in the Canadian healthcare system. They perhaps, with a few of them, decided to pursue another pathway, another regulated profession. So it didn't require them to study, from the beginning, take the examinations, start that regulated profession, but it allowed them to stay in Canada when they weren't able to go back home to update their clinical recency and have a healthy career in another profession that did make them happy, and they were able to support their family. And that was really wonderful, because most times you keep hearing, as I said so as well, that okay, you need to update your medical clinical recency. But just seeing that they were really heavily involved in the healthcare system, and they were able to showcase their teamwork capabilities, their communication, and develop those strong networks, they were able to really showcase those accomplishments in front of the residency programs, and they were accepted. So that was really great for me to see, because again, most individuals who are in this field will say that if your clinical recency has a huge gap, then there's no chance or no opportunity. So I've seen the opposite of that. I've also worked with individuals who perhaps had lower exam scores and then felt that they had no opportunity. Things have really changed over the last couple of years, and I've been able to see applicants who maybe perhaps didn't do as well in a particular exam, but then really worked on their whole package, their whole portfolio. They really tried to get themselves out there and work on themselves. And that was wonderful. Again, they I guess defeated the odds, right? They were able to succeed against what everybody else was telling them. I've also seen so many applicants who, yes, who have had, just kept hearing from others, you're never going to make it, it's never going to work out for you. And then they were able to. And I think I want to tell you one more story of a client that I helped last year who was only considering a particular pathway for so long because of some of the information that she was receiving as well, with regards to this pathway is better for her because she was a more of experienced doctor, and she never considered medical residency as an option. And through the work that we were doing and the guidance that I was able to give to her, she saw it was a possibility, and she ended up being accepted at a time that she wasn't even preparing for it, and she was really happy. So it's just, again, as I keep mentioning, it's always believing in yourself and just following. Like, of course, you have to know the system, and you have to network, and you have to follow all of the requirements, but always just believing in yourself and just trying to ignore all the noise around you.
Yeah, sometimes, that's, you need to hear it from someone else, in order to do that. So, Ranika, thank you for, your inspiring and encouraging words for everyone here today. I know we've got people who want to talk to you directly and have questions for you directly. So I'd like to take a moment at this point to open up the floor. And the way the process will work is if you have a question, just simply raise your hand and I'll call on you. Feel free to turn on your video if you have a question for Ranika. I know some people have been sending me messages as well in the chat, which I will go through as well. But is there anyone here that has a live question that you'd like to ask? Please, Apurva.
Hello.
Oh,
Hello.
Hi
hi.
there. I'm going to.
Please go ahead.
Okay. Hi, and thank you for sharing so much of information. My name is Apurva, and I'm a level 4 healthcare administration and service management student. And back down from my country, I have a relevant 5 years experience in healthcare. So whenever I'm looking for the job prospects in the administration field, I always saw like the medical terminology certification is required. So I just want to know because I am a medical graduate, not the MBBS one, but I have a professional degree back down from my country, and we did all the medical terminology like course in my field. But still, do I need a specific certification in medical terminology here in Canada?
So I guess with why it can be challenging and definitely confusing is that, for certain, as I mentioned, for certain professions in the healthcare field, if they are regulated professions, you do have to follow with the requirements that they are looking for and asking for, right? In some cases, you are able to find positions, what I have seen, at least in my experiences, based on your current credentials. But if it is a strong requirement that the employer is looking for certain credentials or criteria, then most likely this is what they've always been, accessing or using in the past. So this is what they are looking for. So again, I believe that the best way for you to find positions that are suitable for you based on your experiences is to have, as I keep talking about, having a strong document, strong CV, strong resume, where you're clearly identifying all the experiences that you have had and all of those competencies. And being able to network and being able to find connections with different employers that can give you some of that feedback as well. Unfortunately in the healthcare field, because there's just so many requirements and because many of these positions are regulated, there are strong criteria requirements that you do have to fulfill.
Oh, okay. Thank you so much. And can you please just one more small question? Apart from the administrative jobs, like after this course, healthcare administration, it's a 2 year program. Can I switch over to some other domain? If you can tell me some good opportunities apart from administration.
Yeah, so a pathway that I've seen with a lot of the applicants that I've worked with is that in medical administration is a great pathway and opportunity, especially I feel in Ontario, because there's a lot of administrative burden right now for physicians who are practicing. So I feel like it's a great and growing field and will just continue to grow. Perhaps clinical research could be an area that you could be interested in. And I see that could be like perhaps like a pathway that you could look into, maybe different types of job opportunities and the credentials that you would need. What I have seen from some of my clients in the past is that depending on their background and the experiences that they already have, maybe the educational requirement isn't as long as some other regulated professions. So I've seen applicants find great positions in hospital sectors or other sectors with a 1-year clinical research educational certificate. So that maybe that could be an area that you could be looking into, as well as I mentioned, healthcare and technology and AI. Those are growing fields as well too. So I think there'll be a lot of job opportunities there.
Okay.
Thank you so
Thank
much.
you so much.
You're welcome.
Ranika, we've got another question in here. We've got a queue for you. So we've got Navdeep, if you'd like to unmute and ask your question. Thank you, Apurva, for your question.
Hello, ma'am.
Hi, nice to meet you,
Ma'am,
Nancy.
actually, my background is food science, so I wanna ask that if still I have a chance to enter in health field, like for any other any position in health field. Like I have a background in food science,
I'm sorry, did you say what science?
like food science technology.
Okay, okay. So you wanted to ask if you have an opportunity in
E- yes. If I have an opportunity to enter in health field for any position, any clinical or non-clinical positions.
Mhm. So again, as I mentioned, you really want to be able to narrow down a little bit and think about what are the fields or the positions that you are mostly interested in, and then be able to do that research and be able to see, okay, if these are potential pathways or positions that I'm interested in, what does that look like with regard to the educational requirements, the certifications? There really are so many different healthcare fields out there, but most of them do require, as I mentioned, especially if they're regulated, that you do have to fulfill the educational requirements and the criteria that they are looking for. So I think the first step, what you would need to do is really be able to think about what kind of jobs are you interested in potentially pursuing, and then do that networking, the research, find out what the educational requirements are. For some people and some students that I've worked with in the past, they're not interested in studying for 2 to 4 years afterwards, right? So it really depends on how much, especially, Sisha, you were talking to me about the medical pathway and process. I feel like I maybe shocked you a little bit to let you know that this is how I'm just so used to it. I'm so used to my clients studying for however many years. And many of them who are international medical graduates are transitioning from already going through that process. They've already gone through medical school and training in another country, and now they're coming to do it here again. But for some individuals, studying for that long may not be an option for you.
Thank you so much for your
Thank
question,
you so much, ma'am.
Navdeep.
You're welcome.
I just wanted to mention as well, feel free to reach out to me on LinkedIn. I have a resource that I can share with you that can help you identify different pathways based on your knowledge and skills that might be useful, Navdeep. Have another question for you, Ranika, from Dr. Kashani. Dr. Kashani is wondering about the job prospects post a clinical fellowship as an IMG specialist from an improved jurisdiction. They just want to know from you, how does the job market look like at the moment for IMGs? He does not want to be unemployed after going through QE1 and the RCPSC, since both can take up so much of time and finance. Additionally, what is the success rate of an IMG landing a job in the practical world?
Okay, so I just wanted to maybe get some clarification from you as well, if you are okay with maybe just adding in some further information in the chat box. So if you are coming from an approved jurisdiction, to my understanding, I can give you some examples. You could have completed your board certification, as an example, perhaps in the UK. So this is one of the countries that are technically a part of the approved jurisdiction. So if you are coming from an approved jurisdiction, the licensing pathway is technically different from the pathway if you are coming from India, as an example. So the primary group that I work with are doctors who are coming from India, as an example. And this is, I guess this is the harder, more complex pathway. But if you're coming from an approved jurisdiction, really, you just need to know where the job opportunities are and understand what the job market looks like. So as I mentioned, we have huge shortages in so many different specialties in Canada right now. So it's not going to be a problem or an issue for you to be able to find a job opportunity, especially if as I mentioned, within primary care. But if you're looking for a position as a specialist, it's just, again, having those networks. There's actually a lot of recruiters in Canada. If you'd like to connect with me directly, please feel free to do so over LinkedIn. Perhaps I can give you some information or point you in that way, or I could connect you with a recruiter who would be able to showcase to you different opportunities depending on the province that you're interested in. And if you're coming from an approved jurisdiction, different provinces have different requirements for your license as well too. So please feel free to connect with me directly over LinkedIn, and I could guide you in the right direction.
Thanks, Ranika. Thanks. I was listening to that.
Okay, perfect. Perfect.
Thanks.
So yes, please, I'm on LinkedIn, so you have my first same last name, and just connect with me and I'll be able to help you.
Right. Thanks so much.
You're welcome.
Thank you, Dr. Kashani, for your question. So is Michelle still here? I saw Michelle's hand was up. If Michelle, you're here, you're next with your question.
Yeah, I'm here. Can you hear me?
Yes, we can hear you, Michelle.
Okay, thank you. I just want to know about if a technician of medical equipment is highly competitive yield, because I made some application, but and I saw some application they don't ask for certification or this kind of things, but I don't have any response yet.
Okay, and I heard you, if you could please clarify, I heard you say that you haven't received a response yet, or you didn't see certain criteria, but which profession? I couldn't hear the full, which position are you looking to apply to?
Technician of medical equipment.
Oh, okay. So technician of medical equipment, I don't believe that there is like strong certification required in that area, although I'm not 100% sure or familiar. But what I have been able to gain from my experiences with helping a lot of candidates in the healthcare field is that if that criteria is not clearly indicated as a requirement, then most likely you're still able to apply. So I would really focus on trying to make your documentation as strong as possible and really paying attention to the details of the job opportunity they're posting. So that way you can speak about your own experiences that match what those requirements are. So, you know, some other advice I'd like to give you, unless it's a profession that we know that you need to be regulated in and, you know, have a registration in, there are many positions that even if it's I guess if it's preferred that you have certain criteria, you can still go ahead and apply. I know that in many cases, they're going to indicate that information, what they're looking for. But again, if you have strong documentation, you're able to make, you know, build some networking and maybe make some connections, you could hopefully have an opportunity.
Okay, thank you so much.
Thank you, Michelle, for your question. We've got Piu Yan next. I hope I pronounced it okay.
Yeah, your pronunciation is perfect. Thank you. Ranika, I'm wondering, because back home I have a certification in clinical research. There's a good clinical practice and public health research. In terms of clinical research, what kind of certification are we looking for in Canada?
So that's great. That's great that you already have that certification back home and that you also have the good clinical practice as well too. So in Canada, so again, my advice is always, always with depending whatever your given profession is or the profession that you're looking to learn more about, always having a strong understanding of generally what their criteria is. Also, you could, you know, sometimes in cases they also ask for you to be regulated or registered with the association in that province. So you always want to make sure that that's, you know, a requirement as well. But when we're thinking about certification, this is the same advice that I give to a lot of my IMG clients. You really want to be careful on clinical research because there are a lot of sometimes private institutions as well that offer certification, but they're not well recognized by the employer. So this is why it's important to do that research. I think the most simple way for you to do that research is to be able to, you know, contact others who have already started that profession or currently working and ask them, or be able to see even on LinkedIn. Sometimes you can look at profiles and you can see where did they complete their certification. So a strong suggestion would be that you could look into colleges such as Seneca, Humber. They have strong clinical research certification that I believe is a program that's 1 year. And I've had many of my clients be able to complete that and find really great jobs at very well recognized institutions within University Health Network, CAMH as an example. So again, definitely do your research and know that there are a lot of programs that offer certification, but you really want to be able to know which ones are going to be the ones that are going to be more recognized by the employers.
Thank you. How about physician assistant? We seldom hear about this profession.
Yes, physician assistant. Thank you. I should have mentioned that one before when we were talking about different careers. Physician assistant is a great option. It's, I think, soon to be regulated in Ontario as well, too. So currently in Canada, there are 5 different programs where you could obtain the education. And I believe that through Health Force Ontario, they even have an opportunity or a project that is allowing different employers across Ontario to be able to find employment opportunities for graduates. So there's a lot of emphasis right now in the physician assistant role. So I believe, my understanding, you could just, if you want, you can reach out to me directly over LinkedIn and let me know, and I can send you a good resource that has all the information about the different programs in Canada through a recent graduate who's now working as a physician assistant, and I can put you in the right direction. But it's a great opportunity. And the fact that there's also some support from the government level to help you find employment, I think that's also wonderful as well.
Thank you so much.
You're welcome.
Thank you for your question, Pyoyan and Ranika, for your feedback. I think we have time for one more question. I think Ayush has been patiently waiting. Ayush, feel free to unmute and share your question.
Thank you very much, Suchi, and I hope I pronounced your name right. And hello, Ranika. Thank you for here and helping us out with the questions. So some background information about me. So I'm from India, and I did my undergraduate from the US. And so I was pursuing pre-med pathway. My major was biology. And so it was a 4-year course, and my aim was med school. So I really wanted to, become a pediatrician or something, or a surgeon of some kind, but I wasn't sure what. So I went there. I did my undergraduation from USF, University of South Florida, which is in Tampa Bay. And right after graduation, I got to know that there are a lot of restrictions and limitations for me as an international student from India, because I was in F1 visa, and we don't really get scholarships and different help from the government. So I dropped that idea. So then, I decided, and with my parents, that we should try Canada. And then I did some career consulting, and right now my major is occupational health and safety management from Lambton College. So I wanted to know so I have 2 questions, Ranika. So first is, can I still appear for MCAT? Because I do have, not that, I would want to become a doctor, but I just want to see, if I can crack it, if I give my time. So I have the research experiences, I have letter recommendations, and I have decent GPA. So I was wondering if I should give MCAT a shot. And second, if I'm pursuing occupational health and safety management, is that the right call, or should I reconsider?
Okay, well, with regards to your second question, I think that it probably is a great call, great decision, because I've seen others pursuing that pathway and being able to find really great jobs, and I think that there probably will be a lot of job opportunities as well. With regards to your first question, are you eligible to pursue the MCAT? With your current education, I'm not 100% sure right now, but I was just thinking, if you are comfortable to connect with me over LinkedIn, I can look into this a little bit for you and then get you that answer.
Absolutely, Ranika. I will be more than happy. Thank you very much.
You're welcome. So I will just look out for you connecting with me. I'm just going to indicate your name right here, and I look forward to helping and supporting you with that question.
For sure.
Wow. Well, thank you. Thank you so much for your questions. To all of our guests, our students, our newcomers, welcome again to Canada. And we're doing this conversation for you to help you connect and get the information that you need live from our experts. And we do this every month. We have live experts coming to share with you their insights, employers and experts, as well as Ranika's expertise in healthcare on the medicine side. And we are looking for your feedback. So please let us know if you have any feedback, any further questions on future sessions. Next week, on July 17th, we've got the Career Development Q&A, where you can also have further questions and answers with career coaches. On July 24th, we have a free immigration Q&A where we can share with you, PR options. We will be focusing that discussion for low-skilled trades and trade occupations. We also have a session on July 31st on finding a job in Canada. And then August the 7th, we've got AXI experts again. So please join us for our follow-up sessions. You will be able to see new emails and new events in our newsletters. So make sure you're signed up on our newsletters and our social media. At this point, I just want to make sure that we say a final thank you to Ranika so much for sharing all of your knowledge with us. Thank you guys for joining. Hopefully you found it useful. Please feel free to copy your LinkedIn in the chat if you want people to connect with you, or if you see someone who has asked a question that you had in mind or that you wanted to connect with. If you haven't already, I just want to encourage you to introduce yourself in the chat with what you're studying, what you're pursuing, so that you can connect with like-minded individuals who are here today. This webinar was brought to you by Devant, and we are here to help international students and newcomers succeed in Canada, specifically helping you to remove barriers and help you get an employment in the area of your academic study. So we offer not only those events that I mentioned, we are also going to be offering a Get Hired at Home event in the fall on October 16th and 17th, where you will have an opportunity to meet with recruiters and interview in various areas. So, if you are still looking for a job and you've got questions around that, feel free to connect with me as well. Would love to stay in touch with you. As I mentioned, we've got a number of resources that are available to you, but the number one resource right here is Ranika, who's offered to connect with you guys. So please take advantage, reach out to her, connect with her on LinkedIn. It's a great opportunity for you to see jobs, resources, and share and grow together. So with that, I would just like to say thanks again to everyone. I'm just going to maybe close our poll. We've had some really great feedback. Thank you so much, everyone. We've got lots of 5 stars and 4 stars. So just going to share with everyone the feedback. Thank you so much. It's really important to us to get your feedback on these sessions so that we can continue to plan very useful events for your success. So best of luck, everyone. Thank you so much for joining today. It was nice meeting you all.